My name is Dr. Andrew Menatti. I'm a clinical neuropsychologist, and part of my specialty is in doing diagnostic assessments for adults who have concerns about different neurodevelopmental disorders like ADHD or autism spectrum disorder. One thing I wanted to do today was talk a little bit about some of what our process looks like when we approach these assessments with adults with concerns that they might have autism spectrum disorder. Autism spectrum disorder is a neurodevelopmental disorder that involves deficits in social communication, as well as presence of restricted interests and repetitive behaviors. So examples of social communication deficits include impaired social reciprocity, such as back and forth conversation or the give and the take when we're in a conversation, problems with nonverbal communication, such as integrating things like eye contact, body language, or hand gestures into our verbal communication, as well as problems in forming, maintaining, or even understanding different social relationships. Examples of restricted interests and repetitive behaviors include engaging in non-purposeful motor movements, for example, hand flapping, using objects or speech in odd ways, being highly rigid and dependent upon routines, predictability, having extreme fixation upon topics, and over or under reaction to different sensory input, including pain. Autism spectrum disorder symptoms are typically very apparent by the age of 3. For example, things that pediatricians might ask parents when there's a concern about autism is whether the child looks at you in the face when you're talking to them. Do they seem to mimic you or imitate you? When you do things in front of them, do they use gestures to communicate their needs, such as pointing to things that they want or they're interested in? For example, does your child, when you go to pick them up, do they raise their arms up like this, anticipating that they will be picked up? Autism spectrum disorder is comprised of several diagnostic labels that were previously used to describe a range of developmental concerns that are now recognized as falling along one single spectrum of disorders, hence the name autism spectrum disorder. Specifically, Asperger's disorder, pervasive developmental disorder, Rett's disorder, and childhood disintegrative disorder are now recognized as falling under the umbrella of autism spectrum disorder. Paragraph. As clinicians, one critically important factor that we have to consider in any diagnostic workup is whether the difficulties that the patient has causes a significant degree of functional impairment, and whether the symptoms that are observed or reported could possibly be attributed to something much more common and less concerning. For example, somebody might become worried that they have autism if they feel socially awkward, if they have trouble making or keeping friends, or if they have some personality quirks that they maybe don't think other people display. Some of these things really can superficially resemble things that we see in autism spectrum patients, but in the vast majority of cases, these things that are occurring, they occur at a very high rate in the general healthy population. Things like social awkwardness or difficulty with friends or personality quirks can result from anything from anxiety to depression or just from normal variation in personality. Though it can be very tempting to attribute these kinds of quirks to autism, the vast majority of cases, something much more common and benign is causing that symptom to happen. We've gotten a lot of patients recently who first became concerned that they might have a neurodevelopmental disorder after watching or reading something on social media. Oftentimes, patients feel different or misunderstood and feel that a diagnosis of something like autism or ADHD can explain why. Many of these individuals have also been seeking either medical or behavioral health care for their concerns and are really frustrated by their lack of progress. So in these cases, it's very understandable why people might start to look for some of these alternative explanations for their concerns, especially when they're feeling misunderstood or misdiagnosed by their current healthcare providers. Unfortunately, though, many of the social media accounts generating content about autism on platforms like Facebook and TikTok are typically not being managed by people with any kind of behavioral health care or assessment experience. It's also really important to remember that these accounts are designed to attract followers, generate likes and comments, not to provide health care. Social media accounts like this have algorithms that are designed to show content to consumers who are likely to interact with it. So many times these account holders will take advantage of a phenomenon called the Barnum effect to generate and build credibility. The Barnum effect happens when people are given vague information that could apply to essentially anyone, uh, but the consumer believes that the information is unique to him or her. For example, somebody on a social media account on TikTok or Facebook might say something like, people with autism are misunderstood by the medical community, when in reality, everyone's probably felt misunderstood at one time or another in their lives. But because this is a concern that the person already has, it takes on a new meaning and a significance. Just remember that the content that you view on social media has been carefully chosen for you by algorithms that predict you will interact with it. These algorithms pay no attention to the credibility, the scientific basis, or the potential harm that can come from consuming bad information. In short, it's so important that you get your healthcare information from reputable sources that exist to provide healthcare, not generate followers. These sources include members of your healthcare team, and reputable online sources would include places like the Centers for Disease Control and Prevention, Mayo Clinic, Cleveland Clinic, Johns Hopkins, among many others. If autism or ADHD is a concern for you, it's also important, if you choose to seek a diagnosis for these things, that the assessment that's conducted is performed by a qualified healthcare professional. Typically, this is somebody like a clinical psychologist or a clinical neuropsychologist. These evaluations do tend to be covered by health insurance with the appropriate doctor's referrals.